Imagine battling depression for years, trying medication after medication, only to feel nothing change. Now, suddenly, doctors are reaching for a drug most people only know from nightclubs: ketamine. Ketamine and esketamine are now being prescribed in psychiatry, and some call it a game changer. So, is this really the breakthrough for treatment-resistant depression, or just another overhyped quick fix? Let's find out. Today we are going to break it down, what ketamine and esketamine actually do to your brain, how well they work in treatment-resistant depression, the side effects you really need to know about, and why this medicine must only be used under medical supervision. Before we move on to esketamine, let's talk about its ancestor, ketamine. Ketamine is an anesthetic that's been around for more than 50 years. You might have heard of it as so-called horse tranquilizer or even as a party drug. But in medicine, it's mainly used for anesthesia, pain treatment, and off-label for depression for the past 25 years. Depression changes the way your brain cells, neurons, communicate. Normally, neurons talk to each other through neurotransmitter, tiny chemical messengers. But in depression, that balance is disrupted, and some of the connections, called synapses, weaken or stop working. That means brain communication slows down, and people can feel stuck, hopeless, or numb. Most antidepressants try to fix this, but they can take weeks to work. Ketamine is different. Ketamine works on a brain system called the NMDA receptor, which controls a chemical called glutamate, and glutamate is like the main electricity of the brain because it helps neurons send signals. The brain reacts to ketamine by releasing more glutamate in certain areas. That glutamate then activates another receptor called AMPA, and it sets off a chain reaction that makes the brain release BDNF, brain-derived neurotrophic factor, which helps repair and build new connections, especially in the prefrontal cortex, the part of the brain that controls mood and thinking. Scientists still don't know everything since ketamine stimulates many receptors in the brain, also the opioid system, but research shows ketamine resets the brain's wiring in some way and helps the brain cells reconnect much faster. That's why some people feel relief in hours or days, not weeks. That's why ketamine is so popular. There is always a but. After one treatment session, mood often improves within hours, peaking around 24 to 72 hours. But the benefit fades within about a week for many people. Several analyses report an average duration of about 7 days, with many patients relapsing by day 7 to 14. If people get repeated infusions over 1 to 2 weeks, the improvement can last longer, but still usually not very long after stopping. In one study, among those who responded, the median time to relapse after the last infusion was 18 days. Ketamine is fast but brief unless it's continued or combined with a maintenance plan. That plan might include scheduled dosing, an oral antidepressant, and psychotherapy. Ketamine is not a new drug, but there is another reason why it has become so popular lately: esketamine. If you think of ketamine as a drug made up of 2 parts, esketamine is just one of those parts. Esketamine, commercially known as Spravato, was approved by the FDA and the European Medicines Agency (EMA) in 2019, and Johnson & Johnson launched it as a nasal spray. This approval was given for adults with treatment-resistant depression, but only in combination with oral antidepressants. However, in January 2025, the FDA expanded its approval, allowing Spravato to be used as a monotherapy. That means on its own for adults with treatment-resistant depression. If you are going through a depressive episode, whether to try ketamine or esketamine is something you need to decide with your doctor. Remember, ketamine is still a treatment that's usually chosen only after other medications haven't worked. It's still not the first treatment doctors try. So, how effective are ketamine and esketamine really? Let's take a look at the studies. Over the last 25 years, thousands of papers have been published about ketamine and its place in depression treatment. Some of the most striking ones show that in treatment-resistant depression, ketamine and esketamine help about 50% of patients achieve a reduction in symptoms. It's important to remember that these are patients who have already tried at least 2 oral antidepressants, sometimes even other treatments too, that unfortunately didn't bring the expected improvement. That's why they are called treatment resistant. And about 30% of depression patients fall into this category. That makes a 50% response rate very significant. It gives new hope to patients who felt out of options. Both ketamine and esketamine can cause side effects. Dissociation, feeling detached from your body or reality, almost like a dream or out-of-body experience. This effect is one reason ketamine can be addictive or misused outside of medical care. Dizziness, nausea, vomiting, headache, sedation, increased blood pressure or heart rate, anxiety or restlessness. Most of these side effects are short-lived and tend to happen during or right after the dose. Medical staff usually monitor patients for safety, and you typically stay in the clinic for about 2 hours after dosing. Here is the scary part. Ketamine abuse is nothing new. It's being used recreationally for decades in clubs. The dissociative, dreamy escape feeling can be tempting, but chasing that high is extremely risky. Repeated misuse can cause addiction, severe memory problems, mood swings, bladder and kidney damage, and long-term brain changes. As ketamine and esketamine become more widely used in psychiatry, some people may feel more encouraged to experiment outside of medical settings. But remember, ketamine is a medicine, and like any medicine, it has side effects and contraindications. It should be used under a doctor's supervision when there is a clear medical reason. So, to sum up, ketamine and esketamine are powerful tools in psychiatry, especially for people who haven't found relief with traditional treatments. They work differently, they work fast, and they offer real hope, but they're not magic pills. Unfortunately, they don't work for every patient. And they also come with side effects, risks, and must never be taken lightly. This was the first video in my Ketamine Esketamine series. There is still a lot more to cover, so if you want to learn more, make sure to subscribe and stay tuned. Easy peasy, right?